Supplementary. Has she or her office had any involvement in preventing ED wait times from being publicly reported, and if so, what involvement?
Mr Speaker, I have, at the time that, at the reports that the role of my office has been to request that Te Whatu Ora publish the correct data.
Correct.
I'll give the member an additional question if he wishes to take it.
Supplementary. Has she issued any instructions to officials to withhold ED wait time data, and if so, when?
Mr Speaker, the member raised concerns publicly about errors in emergency department data. I asked Te Whatu Ora to ensure they published the correct data.
Point of order, the Honourable Michael Woodhouse.
I could see you thinking very carefully about that answer, Mr Speaker, and I suggest to you that it still wasn't addressed. Dr Reti asked not whether data should be published when it is accurate, but whether the Minister or her office had an involvement in the delay of that data.
Well, I was thinking very carefully. The member is correct. I was thinking really carefully about it. In hindsight, I probably should have offered another question. I think it hasn't been addressed. So I'm going to ask the member to ask it again.
Supplementary. Has at any time she offered instructions to her office to withhold the public reporting of ED wait time data, and if so, when?
Mr Speaker, there was a protracted period of time where there were concerns about the accuracy of ED data that Te Whatu Ora held, and consistently throughout that I maintained a position that the correct data should not be released. The correct data should be released.
Does she stand by her recent statement about the health system that, quote, we are actually doing all right, unquote, when on Monday, Waikato Hospital had almost every ambulance in the region parked for up to 4 hours waiting to get into ED, leading to St John's declaring a major incident because of the delays?
Mr Speaker, yes, I do. Overall, we have made phenomenal progress with our health system. We are driving waiting lists down.
Supplementary. Does she stand by her recent statement that the health system is doing all right when Waikato ED was issued with a provisional improvement notice this week because severe staff shortages and unmanageable workloads had made the department critically unsafe?
Mr Speaker, I take and Te Whatu Ora takes those issues of health and safety incredibly seriously. I understand Te Whatu Ora is responding to that notice.
Supplementary. How are we to test the veracity of that answer when she's unable to report workforce shortages in EDs?
Mr Speaker, that is what I have been advised by Te Whatu Ora, but I would also put it to the member that we have, this government, and particularly recently, has done a huge amount to make sure that informative statistics and modelling is available on the issue of the health workforce in a way that hasn't been before.
If the health system is doing all right, how does she explain a letter sent to her on July 25th from concerned ED staff at Palmerston North Hospital who wrote, quote, we are practising under crisis standards of care without public acknowledgement that we are doing so, and the moral injury experienced by our staff is no longer episodic but is a constant state of existence, unquote, while at the same time communications with union representatives were stating that national leadership needs to provide us with both a vision and a plan. We don't really need another site visit, unquote.
Mr Speaker, I have visited that emergency department and will continue to do so to make them know that the government is concerned around the status of that hospital. I am concerned to see that Te Whatu Ora responds to the report on the culture at Palmerston North Hospital because that is very important.